Hello, everyone, and welcome to the second Insights from Women Leaders event. My name is Rula Kakan. I'm the CEO of Salus Vitae Group, and I'll be the host for the event. The Insights from Women Leaders series includes sessions highlighting the journeys and contributions of various women leaders in healthcare. These industry leaders will share their insights on a range of topics impacting healthcare, our communities, and their role in shaping the future. We have a diverse and global audience today at different stages of their careers. Our inaugural event took place last Friday, October 16th, with Dr. Lucinda Main, the Executive Vice President and CEO of the American Association of Colleges of Pharmacy. There were several key takeaways and actionable items from our conversation on pharmacy, women in healthcare, leadership, and others. I encourage everyone to check out the recordings if they haven't already done so. The recording is available on our website. Over the course of an hour, I'll be asking our guest leader a number of questions, and then we'll open it up to the audience questions. So please submit any questions you may have in the Q&A box. We encourage you, both during and after the event, to post your key takeaways from the event in the Q&A box and on various social media platforms, and tag us at Salus Vitae Group. We love hearing how you benefited from the various insights and experiences of our distinguished guest leaders. The event will be recorded and available for replay after the event. Now, this month happens to be the American Pharmacist Month, and this week is the National Pharmacy Week. So what better way to highlight the contributions of pharmacy professionals than to speak with a renowned pharmacy leader. So I'm delighted to welcome our guest, Dr. Sandra Leal, today. So Dr. Sandra Leal is the Executive Vice President of SinfoniaRx, a TRHC solution. She is responsible for the oversight and expansion of progressive pharmacist services that focus on outcomes, access, and quality. Her work has been published in Diabetes Care, Advances in Chronic Kidney Disease, American Journal of Health System Pharmacy, the Journal of the American Pharmacists Association, Annals of Internal Medicine, and a discussion paper published by the Institute of Medicine entitled Patients and Healthcare Teams, Forging Effective Partnerships. Her programs are a two-time recipient of the American Pharmacists Association, or APHA, Foundation Pinnacle Award, ASHP Best Practice Award in Health System Pharmacy, and the National Association of Community Health Centers Innovative Research in Primary Care Award. She was recognized as APHA's Good Government Pharmacist of the Year for her advocacy work on pharmacist provider status, and was installed as president-elect for the American Pharmacists Association for the 2020 to 2022 term. Her passion and focus areas include working with medically underserved communities, digital health, provider status, among numerous others. When I asked her what her passion areas were, she paused and she's like, there's too many, so let's just pick the top. So she has an array of experiences, and we're truly honored to have her today. So welcome, and thanks so much for taking the time to be with us today.
Thank you. It's a pleasure to be here, and thanks a lot for the opportunity to speak, especially after Lucinda Main. She's such an icon in pharmacy, so to be included in this series is a real honor. Thank you so much.
Thank you. It's our privilege. Okay, so let's get started. So we're just going to have a series of questions that we've prepared ahead of time, and then of course, please, all the attendees, you're welcome to submit your Q&A in the box, and we will address those towards the end of the conversation. So we like to start off with the conversation with our first question is, did you expect to be where you are today?
Definitely did not expect to be where I am today. I look, when I wake up in the morning and I'm running a division of this very big company, and I'm sitting as president-elect for the American Pharmacists Association. These were not in my career thoughts when I was in pharmacy school. I loved being a clinician and still love the work of what the pharmacist does to help patients have better outcomes. And so with time and after working in that area and seeing a lot of the challenges that pharmacists face, that patients face to access care, I ended up just doing more progressive management opportunities to try to break down some of those barriers that people were experiencing. And I think that's what ended up leading me to this path that I am now, but I never imagined doing that. I just felt like a lot of the system issues that we were seeing and a lot of the policies that existed were barriers for people to access care, for pharmacists to do the work that we were trained to do. So it just sort of set me up in that direction to try to advocate for the right things, try to really go into more of that policy arena and try to change things on a global level versus like one individual at a time. Because I think, you know, people were just experiencing those same problems over and over. And I wanted to figure out how can we actually challenge that and fix it, fix it. So I'm kind of like the fixer on different issues. So that's how I ended up getting here, but not what I imagined doing, although I really enjoy it now.
Awesome. I love how when we look back in our career, we always wonder at what point, what brought us to where we are, and did we expect that? So, what we're going to do is we're going to actually start with the future in mind. So we're going to spend some time in the future and then come back to the present. And obviously throughout, we're going to recall items of the past, of your past experiences. So the next stage, I guess, in our conversation is going to be what's in your future? What do you want your legacy to be?
I definitely want to make sure that I have contributed to the profession because it's given so much to me. Like I am so blessed by having been a pharmacist, be a pharmacist. It's given me opportunities I never imagined I would experience. I've had the opportunity to travel internationally, to help people in ways I didn't imagine I was going to be able to. And so I always feel like, what can we do to leave things better than we found them? So one of the things that's always driven me is how to make sure pharmacists are always part of the care team. You mentioned in my bio some of the awards that I've received around best practices, and like the best practice award for ASHP or a Pinnacle award on a program I started. And for me, I don't want to be a best practice. I want to be a standard of care. Like I want to make sure pharmacists are always part of the care team, because every time I saw a patient, and every time we now develop an intervention where a pharmacist is part of the solution, it's incredibly shocking to me what would have happened to that patient had a pharmacist not been there to actually catch all the things that we find when we're intervening with a patient. And on any given intervention, we find 2 to 3 different things that we recommend or do through either collaborative practice or through interprofessional collaboration with providers to address a problem that was going to be significant if it was not addressed. And so we contribute a lot to improving the patient's health and outcomes, and then to total care. So I don't want to be a best practice. I want to be the standard of care. And so that's what drives me, to make sure that every patient has the opportunity to always have that pharmacist proactively managing their care, and managing their care during the time they're taking it. And then, as things have to be changed, because we all know that care is not stagnant, that different pieces, different aspects of your life change your conditions, be it, depression, a pandemic, whatever's going on, that it's something that you always have to be working with a patient to make sure that they always have good outcomes and advocacy to have the best results. So those are the kinds of things that drive me, and why I feel like that's where pharmacists have to be, and that's the future of where pharmacists have to be, so that we have, that I have the ability to impact how that goes, and all of us do, right? Like I feel everybody has the opportunity to advocate for that in their own profession, their professional experience, but then in how they can potentially change policy legislation within your system, within your, your arena, to be able to make that happen.
And I actually love that distinction with the best practices versus standard of care. And often in public health, we always talk about sustainable interventions and interventions that are reproducible and that will last a while and that are common practice. And so I think as pharmacists, then we do have that terminology where we think from best practices to standard of care. So I really like that, actually, because I often talk about sustainability and reproducibility, but I find myself being that public health in that public health light. So the next question pertains to what excites you about the future?
What excites me about the future is all of the potential out there to really make an impact. Like I love technology, and I think about all the ways that we can leverage that to be able to enhance how we reach patients. So it's not to replace the personal relationships that you have with people, but it's to create additional touch points, additional check-ins with individuals. Like one of the things that I find super exciting is the technology around language translation. I don't know if you've been following that, but your phone, you can actually speak into it and then a different language comes out and then the person can speak into it and then communicate with you. So when I look at tools like that, I think, how can we use them and apply them so that people actually have better information, better communication? How do we actually leverage that and not feel like it's either taking away our jobs or our, competing with us, but it enhances our abilities to do that. I also love all of the remote monitoring kind of things, like excited about the watches that can now do your pulse ox. I mean, talk about what an incredible tool with COVID, where everybody's wondering about their pulse ox. Now you actually have it on your wrist. You can monitor that and see how people are doing. Do a lot of education around that. Like what's normal, just because it reads a number doesn't mean that a person knows whether it's a good number or not. So there's always going to be value in, how you could communicate that information, how you work with people who have anxiety about information, and then make sure that they have the best advocate right along with them. And so it's things like that, if you think about them and how they can help, versus how they compete, that really will make the difference. And I'm always a very optimistic person. I try to find the silver lining in things, versus feeling like something is going to, replace me or take away an opportunity.
I think we live in an age right now, and it will be into the future in terms of the amount of information that we have at our fingertips, and then that we're able to better utilize, I think is going to be very exciting, exactly to your points. So the next question is, what do we need to consider moving forward? For example, what tools do we need as we think about the current challenges and into the future?
Yeah, there's so much information, to the point that you were making earlier. There is so much information out there. So I think some of the, the tools that we need, and these are things that we already know, right? Like critical thinking skills. How do we train or teach people to really look at that information and pick out what's actually valid versus something that's, maybe just a tagline because somebody wants to, convey a message that might not necessarily be facts. So I'm very careful about the information that I'm receiving, and then trying to really think critically about what it's saying, what the value of it is. So I think it's really important to, connect with people that understand the literature, do journal clubs, do that, that communication, go back to your roots of like how you're trained so that you really understand what's going on. Look at multiple sources, not just one source. And don't form a bias based on how the information is being fed to you, but try to really come at it with an objective point of view. And so that's just some of the things I think about a lot. And right now it seems like it's even just more challenging. There's a lot of information that's being politicized instead of actually like giving us the information we need so we make our determinations based on facts. So those, I think, tools that help us understand what good literature is, going back again to the roots of how we're trained, and then just trying to be objective. Those are the kinds of things that are going to help us to maintain our credibility and to make sure that we are providing the true or the best information we have at the moment. And it goes to the statement I made earlier. Just because it's true today doesn't mean it's going to, be the same. It changes with more information. It changes, and you also have to be open to always being a lifelong learner, because you have to keep up with the information. It's just changing so quickly that you have to know that, okay, something changed. I'm okay with that. Like, let's go on and let's figure out how to adopt that, how to, make sure that people get that right information as it's changing also. So being open to understanding that something has more information than it did even a week ago.
And actually, I love that point, because I think it's very critical, because I find myself too, even as I look in terms of the literature, the information that I read, I actually also think back, like, how was I trained to look at this? Because it looks different, right? Like as a student, we get the journal clubs, we see the articles, we get our information presented in a specific way. And then as you kind of progress, depending on your setting, you look at literature in a specific way. But when now the type of information, the way it's communicated is so different. And then you have to be intentional about how you critique. like the literature. And so understanding that, and I think that's a powerful, powerful tool, like you mentioned. And I'm so happy you mentioned that because it's going to be very instrumental moving forward. So we do want to take some time to provide you an opportunity to highlight some current initiatives that you're working on. So what current initiatives that you are working on that you're most excited about?
So a lot of the initiatives I'm working on are really around creating solutions for gaps that exist in care right now. And as you look at the way that CMS is pushing down more risk to providers and to payers, a lot of the things that we're trying to make interventions on are things that aren't being addressed fully. So a couple of things. One of the big projects we're working on with Tabula Rasa is a medication risk score. And essentially, I always think about it kind of as like a FICO score on your credit. Do you have a good score or not? Well, this is the similar concept. Do you have a good score or not for your medication risk? So it's like a risk stratification score. And then based on that, having pharmacists make interventions to then, in this case, you're actually trying to reduce the risk score, because the higher the score, the higher the risk. So pharmacists are actually very intentionally going in there and addressing those risks with the patient so that they know where they are in that risk. And so we can actually see an improvement with that. And that, again, it's not a one-time evaluation because, as you know, healthcare changes, medications change. And then if you think about things like over-the-counter medications, supplements, things your neighbors are recommending, all of that can change. And so we're trying to make sure the patient understands the changes and whether they're good or bad, and then how to communicate with the pharmacist to be able to address their concerns if something is altering that score. So that's a big project. And that really goes to value-based care and figuring out how to, as patients are attributed to a health plan, a system, how to make sure that that patient has a total cost of care evaluated and not just pieces of it and things that fall out. And historically, pharmacy has been carved out or it hasn't been included, but there's so much implications with that if you're not including it in the total healthcare picture. And so we really want to make sure that as you're looking at an individual, that you look at them holistically and not just emergency room visits or not just this or that, but it's everything put together that makes that case. And another thing that falls on, and I'm a public health person, also dental care, my goodness, nobody even thinks about that. And I my whole career has been around working with patients with diabetes. And, if you don't have good dental care, if you're not actually making interventions, recommending cleanings, taking care of your gums, or you have bad glucose control, that has a lot of implications on nutrition and all of that. So it's, again, thinking of that patient holistically. So another program we're working on, aside from the risk score, is creating a diabetes prevention program that's now available to people digitally. So we have pre-recorded content, which would have been the 26 plus classes that a person has to go to. And now we created it in an accessible format that are available in English and Spanish. And then we have health coaches that are now trained to check in with the individual at the increments they would have had to attend the classes. So we did that because we were trying to address social determinants of health. If you look at who's at risk for diabetes, well, it's 1/3 of the United States. There's 88 million people with pre-diabetes, but a lot of it tends to be in underserved communities and rural communities that don't have access. So we were trying to develop like a Netflix kind of content, where if you're told you have pre-diabetes, now you can actually go and grab that content and watch it at your convenience, not when the next appointment is available, or 2 hours away where the DPP class is going to be held. Oh, and by the way, they might not have a Spanish class, but that's what you need. So we try to create content that's accessible at the time the person wants it and needs it. And then that's available in English and Spanish to start, but we're looking at more languages, and then be able to still connect with a person with that personal connection by doing the check-ins with the health coaches. So those are just a couple of different types of solutions that we're trying to create to really address value, to work on not just chronic disease, but prevention of chronic disease. And then to make sure the pharmacist is always part of the care at some point of wherever the person is at in their healthcare journey.
That's incredible. And it's very obviously technology centric in terms of when it's digitally available. This is something, obviously, it takes a long time to create. How long before, I mean, we now live in a very technology-centric world because of the current pandemic, but how long ago did you guys start this initiative with the diabetes modules?
We started that about, gosh, almost about a year, maybe a little bit over a year ago. We started working with the American Pharmacists Association Foundation, and they, through a CDC grant, were able to work with us on that. And we were already doing telehealth before the pandemic. Sinfonia started in 2006 at the University of Arizona at the College of Pharmacy with pharmacy students. And it started around the time that Medicare Part D, when the drug benefit was added. So, so we've been doing telehealth and mostly telephonic, but then using some video technology and certain pilot programs that we were doing. So when the pandemic hit, it wasn't a huge leap for us because we were already doing that. We were, we are like, wow, this is incredible. Now, providers and groups that were a little resistant to telehealth, all of a sudden, because they were forced to have to adopt it so quickly, I'm seeing that a lot of them are so much more open and receptive, and they see some of the values and things that are going to continue post-pandemic. And just one of the things I think about immediately is space. One of the biggest challenges when I used to practice at a federally qualified health center is, as a pharmacist, I was looking for an exam room, and I would literally wait for a provider to be off that week, and then that was the exam room I would use because there wasn't extra rooms available for the pharmacist or whoever else. Whoever else needed to. And now with technology, people are actually scheduling their appointments with telehealth. So now that crunch on space is actually not as big of a deal anymore. Hopefully moving forward, you can actually schedule some telehealth consults, and that will free up some of that space so that you can have a hybrid approach as you're trying to manage populations. And I was just reading an article just a couple of days ago how even no-show visits have been reduced with telehealth versus in person. And you have to imagine, wow, well, it's probably because a person doesn't have to drive there. They don't have all the transportation issues, or even maybe you can still have your child at home with you when you're doing a telehealth consult, versus sometimes it might be harder to transport, an individual. So I think about some of those incredible opportunities that are going to remain and how we leverage those. And one of the other examples I think about is even waiting times. I've actually had to do a telehealth visit. And when my appointment was at 3 p.m., guess what? The provider showed up at 3 p.m. And so there wasn't even that backlog of during the day as you're seeing patients, you fall behind because you're trying to catch up on all the things. And so your 3 o'clock becomes your 4 o'clock or your 4:30. Well, now when you have a telehealth consult, pretty much if it's at 3 o'clock, the person shows up at 3 o'clock because that's the way the schedule is, and they don't have all those other competing priorities. So those are, again, some very tangible, good things that will remain post-pandemic. It's just a matter of us keeping the good things and then continuing to improve and seeing how we can leverage that technology.
Yeah, definitely. All those barriers that existed before in terms of barriers to access. Not all of them have been reduced because you also would say that some communities don't have access to the internet, which doesn't allow them to have that. But I think the wait times, exactly to your point, and many of these other technologies that even I think as you're in your appointment, you can get it translated or transcribed, and having that option also assists several people. So the next question focuses on challenges and obstacles that keep you up at night. So what are some?
Definitely the economy is keeping me up at night right now, because I think about all of the people that have lost jobs recently. I keep seeing restaurants down the street that I loved that are now permanently closed. So it's not even a temporary thing for COVID anymore. These are groups that are going to be impacted forever. And when you look at the number of people that have lost their jobs and the number of people enrolling into Medicaid, that's a huge number. And I think the last statistic I read was like 4 million new enrollees in Medicaid systems that are already very strapped for cash, right? Like you've got a lot of burden because of the cost of healthcare. That's very concerning to me. Also, a lot of the vertical integrations that are happening, a lot of smaller, pharmacies are closing, access points, rural hospitals that are closing. So I think a lot about the challenges that people in rural communities face. So those are things that are significantly challenging. That's why I think about technology solutions. But to your point, that's still not going to help a huge number of people if you still have barriers to internet or data or affordability issues. But again, I think about that. What are the opportunities? What can we learn from that? And how do we position ourselves to be solutions for that? So for Medicaid, we're constantly talking to our groups here in Arizona. I live in Tucson, Arizona, and we talk to Medicaid all the time about the solutions pharmacists bring to the table, how we can help people have better outcomes, how we can help manage conditions. Medication therapy management, the Part D component is for Medicare, but we can adopt the benefits of that in Medicaid and in commercial groups to also show the value, and then think about additional solutions for people that might not even have insurance, because you can see the benefit across any of these groups if we intervene. But those are the things that keep me up at night, how to make sure that people are not experiencing access issues, especially with the economic problems that people are facing. How do we still provide accessible points of care? And I always love that pharmacies are so close to people in the community, so people can walk in. Like right now, if you think about pharmacists, they're amazingly incredible for this pandemic, and they've always been, but like now there's a huge highlight on how essential pharmacies are, right? Like you can go there to get tested. You're going to go there. You're going now for your flu vaccines. When the COVID vaccine comes out, pharmacists are going to be there right in the front lines to be able to provide a very convenient point for COVID vaccinations. And just with the changes with the Department of Health and Human Services this week announcing that they're also expanding the ability for pharmacy technicians and students to vaccinate people. That's incredible. They've also increased the ability for pharmacists to vaccinate children between 3 and 18 across the United States. So all of these things are really positioning pharmacists to be more care providers, service providers in proximity to where patients live. And so that's where I see, even though there's all these challenges happening, pharmacists are really stepping up and serving a need where a lot of things are going to be challenging. But I think pharmacists can be a solution to some of these problems.
Yes, I completely agree. And definitely during the pandemic, if you think about early on when all offices were closed and it was very hard to get appointments and people were still transitioning into digital telemedicine if they didn't already have it. And the one healthcare provider that you could still go down and the pharmacies were still open to really ask your clinical questions was the pharmacist. So definitely, I think we're preaching to both of us are pharmacists, so we definitely believe in the value of pharmacists, but I definitely think it's our responsibility, like much of the work that you've done, to continue to stress the substantial role and value that they have within our communities. Okay, so now we're going to transition to leadership and mentorship. So we asked all of our guest leaders a simple question on leadership, and that is, how would you describe a leader? You responded with the following. A leader is one who can speak for others when they do not have a voice. And then you stated that it was inspired by your daughter, who is a fierce advocate for social justice. Would you care to elaborate on this?
Yeah, absolutely. I think a lot about, and one of the reasons I became a pharmacist was because in my community where I grew up in Nogales, Arizona, which is right on the border between Mexico and the United States in southern Arizona. A lot of the people that lived in that community didn't speak English and still don't, because everybody speaks Spanish there. But whenever we would go and look for a healthcare provider, there wasn't a Spanish-speaking provider. So I wanted to be, a provider that was accessible and people could go to. In fact, they would go to Mexico to see their pharmacist because that's who they could talk to. That's who was accessible. So I always wanted to be that healthcare provider that was accessible. So it always seemed to me that the primary care provider, that the most accessible clinician was the pharmacist. So that's what really drove me to go into pharmacy. And so, now when I moved, I ended up going to pharmacy school in Colorado, and then I moved back to Tucson and I worked at a federally qualified health center. And like 75 to 80% of my patients were Spanish speaking patients. And I spent most of my day managing people with diabetes, in Spanish. So I always felt like they liked to come to see me because I could communicate with them. There was a trust issue. And I would, I would speak for them, and I would talk about what challenges that they were experiencing. So when that quote came up, and when my daughter was, she was experiencing a challenge, and there was a group of girls that she was working with who didn't want to say anything because they were afraid. And she was the one that spoke up. That just reminded me of that. It's like, that's a leader. That's a leader. It's somebody who sees people that might be struggling, that are afraid to speak, that maybe don't have their voices heard. And being able to speak for them and be that voice and then represent their needs. That's what's really important. So it resonates with me because in working with underserved populations, underserved communities, people that experience health disparities, people that have some of the most challenging circumstances, and they're afraid to speak, or they don't want to be identified because of whatever the issues are. If you can still speak and advocate for them, that is really what is a leader. And you don't have to be in a leadership position to do that. You can do that in any arena that you're in, where you can advocate for somebody who might not be able to advocate for themselves. And it goes for, think about it. Wow, women's issues, when you're in a boardroom and you're the only woman speaking for a whole bunch of women that don't get to sit there because they haven't had the opportunity. When you look at every aspect of our lives, there's things that you will bring to the table that you can represent that are not being represented. So that's how I think about that, and why it's important to do that. So I'm very much about mission and social justice. And so I'm glad my daughter is following in that footsteps. I always make sure that, being a good role model for her, hopefully she can continue to carry that torch past me. So.
This is great. What I absolutely love about also defining leadership in terms of a voice, and then you mentioning now, because Dr. Main also mentioned this in terms of you can be a leader in any position, right? It's also how you perceive leadership and what you need to do as a leader in order to be a leader. And I think one that you elaborate on here is use your voice. And so much of that actually, those types of things are characteristic of a leader, is when you do use your voice, when you help others. We even talked about simple acts of asking, how are you, and genuinely meaning it, to build a trusting, genuine relationship. And so I think those are elements of looking at leadership beyond a title, more so of establishing those relationships. So the next question is, do you believe that leadership in healthcare is different than other sectors?
I believe that, there's a lot of elements that are the same. You just apply it in different areas and in slightly different ways. But honestly, the leadership point of, speaking out and advocating, like I think about, I mentioned earlier, pharmacists and being represented on the care team, and how you have to advocate for your role, speak to people that maybe don't understand what your contribution is. So that there is that opportunity to really make that a standard of care. So there's elements of leadership that you can apply in any arena in the same way. It's just that, you're talking about different topics, and you don't have to be an expert in everything. Just be passionate about whatever you're passionate about, and then advocate for that very strongly. And so I think a lot about that. And even when you asked me earlier, what are your areas of interest? What do you want to talk about? I'm like, I have so many things because there's so much opportunity, right? I just had a conversation with students last night about resilience and how to take this very challenging situation we're in and turning it around, and actually doing things and advocating, even though you're at home. And that's one of the things I think people are struggling with right now. It's like, well, I don't know what I can do. I'm just sitting here doing Zooms all day. What could I be doing? How do I get out there? How do I advocate when there's nothing, I can't travel anywhere, I can't go anywhere? But you would be surprised that you can still be very strong in your advocacy, even behind, this computer screen, through social media. It's a very powerful tool if you use it in a way to reach people, to educate. I ended up sharing that I just recently participated in the coronavirus trial. I just received the first vaccine for that. And that's a way to be part of the solution, try to get a vaccine out there sooner, share my experience with others so they're not afraid that it's, working or not, or it's going to cause a problem. And that's just what I feel a form of advocacy. I also became a contact tracer. There was a free course on Coursera that Johns Hopkins University offered to become a contact tracer. And I learned so much from that course. And then I took the information from that and I shared it. So it was great for me to see that because I shared it, other people said, oh, I'm going to take that course. I'm going to be a contact tracer. But the information that you got from that was things that you could share with your family, that you could implement yourself, that I could use in with my company, with my coworkers, so we could be safer, talking about quarantine, isolation, good techniques to avoid COVID. In my mind, all of those are proactive things you can do, and then share the information in a way to reach so many others so that you feel like you're doing something and not just waiting, for something to happen, because you're the person that's making things happen. So it's just those types of things that I feel are like the things that you can do to contribute, to stay active, to lead in any arena. And that goes beyond healthcare, but it's just in the way that you reach out to people. And hopefully, you convey that trust that they need to hear to make them feel better.
Those are all wonderful points. The next question goes in the direction of what are we getting wrong about leadership? I think we often hear different presentations and topics and items about leadership and what it is, but we don't necessarily talk about what we're getting wrong and what we think that what we've heard over the years maybe doesn't work and maybe doesn't apply to the challenges of today or maybe into the future. What are your thoughts on that, about what are we getting wrong about leadership?
Well, I think a lot of people think that you do have to be in a position of authority, like some sort of elevated title, to be a leader. Sometimes the titles get in the way. Like a lot of times you think that your authority comes from that, or that your credibility comes from that. And honestly, it doesn't come from that. And I think it comes with age, right? Like the older I've become and the more experience I've seen, like awards used to be like, oh, this is so great, I'm going to receive an award. Like, those things don't motivate me anymore, right? It's just not something that motivates me, because I think that the best thing to be able to do is to be advocating for something and to believe in something, have passion about something. And then people see and believe and trust in you. And that's where your credibility and that's where your leadership really comes from. It comes from your genuine passion about something. But that's where I feel like, it's such a competitive world right now. I feel bad for people that are trying to go to pharmacy school, medical school. I feel bad for my daughter who's like now competing. It's like, it seems like everything is such a huge competition. Everybody's trying to fill their resume with things instead of really like having longevity in your commitments to things that really matter. I volunteered 2 weeks in a clinic 16 times because I've seen that. I've actually sat on interview committees for acceptance into schools, and I see all of these different things to fill the resume instead of, what really actually spoke to me is the kid that was in soccer from the age of, 5, and he's been in there for like 10 years. I'm like, wow, that's something you cared about. You obviously stuck to that. You had passion about that. That speaks to me that more than like 14 experiences that are a week long just to put 10 hours a week. It's just things like that I think about, like what makes you who you are, what things are interesting about you. I don't want to see resumes that are just the things that you think that I want to see, but I want to see things that are really speaking about you as a person, what your background is, what your struggles are. Maybe you haven't had struggles, and what have you done with that to like actually, change something? I mean, it's all of those things that really speak to it. And I think we just tend to focus on the wrong things instead of focusing on the things that really make people unique and different versus, just the check the box kind of things. So those are some of the things I think about. And I get asked that question a lot from, when I go and speak to students and like, what will make me different? I'm like, well, tell me what makes you different. I want to hear the stories. I want to hear more about you. I want to know, why did you do this or why did you do that versus, just like the typical things you think I want to hear. So I guess that's my biggest thing that we're getting wrong. We're just focusing a lot on the wrong things. Sometimes it's just like the GPA, just the scores, the standards, where like I didn't do so well on the standardized testing because my first language wasn't English. And so a lot of like the standard testing didn't really apply. Like I couldn't, answer the standardized test as well as maybe somebody who had the primary language. And so again, it's just, you can't really tell the uniqueness of a person when you're just standardizing things like that.
I think Well, actually, what I was thinking as you were talking in terms of when people also wait for a leadership position, so a title, to basically give them permission to be a leader. Because you find that people are just, okay, once I become a manager, or clinical coordinator, or CEO, and then I will be a leader. It's like, but what permission are you waiting for? Because there's no permission, it's just more work. It's the work that goes into it. And so I think if you recognize that earlier on, that you don't need permission to be a leader, then you can use a lot of these tools that you've been talking about in terms of building your own leadership, unique leadership style based off of your story. Like you mentioned, like what makes you unique and how can you incorporate that? Because then that way you can truly make an impact. So that is wonderful. So the next question is more on what other leadership lessons and advice can you provide to current and future leaders, both men and women, at different stages of their career? So our audience are anywhere from students all the way to seasoned professionals. And so does your advice vary based off of the different stages of their career, if they're a man or a male or female? What are your thoughts there in terms of advice?
So I think the one thing that I recommend, regardless of the stage of your career, is really thinking about finding a good mentor, a good sponsor. And when you're younger, trying to find somebody that will mentor you or sponsor you. And then when you're older, to also remember that somebody helped you along the way. And, you know, it's not that you find one person and you stick to that person the whole time, but at different parts of your career, there might be different people that really stand out as a mentor. And I think very clearly in my own life, when I was growing up, the people that really made a difference in my life, the people that opened doors that wouldn't have been open had it not been for that connection. And I'll just give you a quick example. My physics teacher in high school, he told me about a summer research program at the University of Arizona when I was a high school student in Nogales. And he's like, you should go, you should apply. And so I did, and that really opened a lot of doors for where I ended up and how I ended up there. But I'll never forget this. After that summer course was over, we had to do a poster presentation at the university, and he actually delayed his vacation so he could wait for my poster presentation. And I remember him walking into this university auditorium with his family, and they were literally all wearing like beach shorts and Hawaiian shirts, and they had like beach balls. And they sat in the audience because they were going to drive to their vacation after my presentation. And that image has always stuck in my head about the commitment this physics teacher had in high school to me as one of his many students, to make sure that I did that. And I actually ended up getting college credit for that course. And that it's those kinds of people. It's the people that just step up and do that thing that are incredible. And what is even more incredible is many years later, I was actually working in a pharmacy, and he came into the store and he didn't know I worked there. I didn't even know he was a patient or anything. And he was just filling an antibiotic for his child. And we ran into each other, and I just like remember giving him a big hug and just like, you know, thanking him because of his commitment and what I had become. And now, like, look, I'm serving as his pharmacist for his family because of, you know, all of the things that he did to like help me there. And I have so many stories about people like that in my life that really opened doors, that did that thing that really helped me advance. So I'm always very conscientious about doing the same thing for others that other people did for me. Doors that they open, you know, bringing people up, being a mentor, being, you know, doing succession planning, giving people opportunities. You know, I get asked to do a lot of things, presentations, write a chapter, write whatever. And if I can't do it, instead of saying no, I try to pass that opportunity to somebody who would really benefit from that, so that they have that opportunity that that is a win-win, right? It's a win because they still have that that task to be done, but I bring somebody along and then they get that opportunity. So that's just something I think is really important. It doesn't matter if you're a woman or a man. It's just that it is those types of intentional, you know, opportunities that really end up being a big difference for somebody else in your career path, in your life. So I highly recommend to do that very intentionally.
And it's definitely twofold with this. And I think the more people you talk to, and the more I've talked throughout the years, and even your own experiences, we all have these at least handful of people where we can tell you a distinctive story that basically changed our career somehow, or our outlook on things. So it's both finding those right people, or those people, and kind of intentionally even looking for that. Sometimes it might seem like a simple story that changed, but also being that. So I think there's two folds to what you were saying as well, is finding and being that person that can help. And so the final question before we open it up to Q&A. So we do want to take an opportunity to support one another and recognize the positive influence we have on one another. Name a woman who has inspired you, and why did you choose this person?
That's a hard question because I have a lot of women. I always think about my mom first, who inspires me. And that is the person that inspires me a lot. She grew up in Mexico and didn't have all the opportunities that I had for school and college. And she's like my biggest advocate, super proud. And she is a great role model. And I always wonder what would have been her opportunities had she had the access to more education, to college, to all these things. So I don't take it for granted for a moment that, my parents are immigrants and they came here and they really, they took a lot of challenges to give us opportunities. So me and my two brothers, we all went to the university, we all have degrees. And so I don't take it for granted for a moment. And then I just think about, there's so many women that I interact with on any given day that I work with. There's the chief operating officer at our organization, Rose Martin, Ashley Coleman, all of these people that I work with that are like incredible leaders, so passionate, so committed. And they care so much about what they do. And they care so much about the people that they work with that I take so much from them, as far as just like being so grateful to be amongst such strong women. I work with a lot of women at APHA. Ann Burns, I don't know if you know her, but she's such an incredible advocate for the profession. And she's just one of the most amazing women out there. So I always look at her as just like an incredible role model. And then I always think about people I work with outside of pharmacy. I have worked with some amazing women. I sit on the National Center for Farm Worker Health, and I've sat on the board with some women that are so passionate about migrant health, underserved populations. And it is incredible to me that these are these fierce advocates that are working on behalf of people that don't have a voice. So I can't name just one because there's so many, but those are the people that really help to raise us so that we can raise others to hopefully have that same, that same impact on society. So a hard question to answer because there are so many.
But the themes that were going through my head as you were talking is definitely the inspiration is tied to passion and commitment towards a cause, even within whatever discipline that you're in. You could be passionate about diabetes, you could be passionate about immigrant health, you could be passionate about telehealth. So there's definitely elements there. Okay, so now we're going to just, we have some questions in the Q&A that we can get to. And then if you haven't asked your question, please feel free to do so in the Q&A box. So the question, there's twofold to this. The first is, what are the new opportunities that telehealth will offer for the standard of care in pharmacy practice? So we can maybe answer that one first before the second one.
Yeah, absolutely. Like for us, we've been using telehealth for a long time. And I feel like there's so many opportunities to make that the standard of care. Like I think that the future will be that pharmacists are available. I always think about like the home devices, like your Google Home device, your Apple Home, your Amazon, all of those devices. My vision is that one day you'll just say, hey, can I speak to a pharmacist? And then they're right there answering your questions, specifically sitting down with you and doing a consult. And that will be the standard to somebody that's super accessible. Just like on your watch, you can get your EKG now, your pulse ox, you can just talk to your pharmacist. Like it's like the, Inspector Gadget kind of stuff that it's just going to be there and accessible. And I always, people are afraid of like pharmacies closing because they're like, well, your pharmacist isn't going to be close by. I actually think they're going to be even more close by with the technology if we use it appropriately. But again, it's not to replace people, but it's just to add even more touch points for you to be able to intervene. And not just in medications. I think about pharmacists managing chronic conditions. Like I'm passionate about diabetes prevention. So we can be part of the care standard for any of these conditions, no matter what it is, as long as something requires medications, or even if you're trying to prevent or de-prescribe, I think pharmacists fit a wonderful role in being able to help manage that.
So the second question is, do you think that with not having an electronic medical record health system is a burden to apply a telehealth communication, as with electronic health system, things are more organized?
I've seen it done both ways. I don't think that you have to have one to have the other. Sometimes it helps to have both because you might have interoperability, but I think you can use telecommunication or um, uh, telehealth to connect to people. And then how you document, you could either document in an EHR, you can document in a patient record, you can even document in any way that you're documenting. And I think about this internationally because people are in different aspects of where they are with EHR deployment, or they're looking at how we deployed ours that might have not worked and trying to do different things, like making it more of a patient record instead of a health system electronic health record. So I feel like there's still so much work that needs to be done with the EHR system. It is not, by far, it is not perfect right now. We need to improve the way it's utilized. We need to have patients have access to it. We need it to be shared. And depending on what country you're at, you're in different stages of it. But telehealth, you can always communicate with people with telehealth through a telephone, through video, through messaging. So I kind of think they're separate, but they can actually help each other to be leveraged in different ways. So I think you can have one without the other effectively. And then obviously you can iterate until you find something that works best for you.
I like that in terms of making the distinction, because with the medical records, it's truly the documentation process, and with the telehealth and how we communicate the services there. The next question is, what is your advice for young advocates to make their voice heard, even if they are not in leadership positions?
I definitely think, find whatever that passion is for you, what drives you, what your mission is. I'm very much about mission and what, you want to accomplish. So for me, I always think, and I live a very, in a very complicated world with the positions that I'm working with. But the one thing that is the significant driver in everything I do is to make sure people have better outcomes. So I always think about how our company helps people have better outcomes. I think about how the American Pharmacists Association works with pharmacists to be able to have patients have better outcomes. When I sit on a board, National Center for Pharmacohealth. I think about my board work there and how that helps people have better outcomes. So even if I'm involved in it, whatever I'm involved with, if I can keep that single mission very clear, all of the complexities, all of the challenges, all of the barriers, I can get through that because I have that mission. And so that makes it less complicated for me, and it makes my decision-making easier because I'm always driving to figure out how to make sure that patients have better outcomes. And if anything is against that, I know that's not the right thing to do. So that's what it is. So find whatever that is for you. If it is a niche in a certain practice area, if it's, a certain disease state that you love and have passion for it, whatever that is, work towards that. That's what's going to wake you up in the morning. That's going to really excite you. And if you find that at any point your mission is compromised, then it's time to make a change. So that's, that sort of is the guiding principle of how I have really led my own career path, and it really keeps things very clear for me. And that's how you find your voice. You can find your voice, you can share it on social media with your friends and neighbors and how you practice, but that's how you find your advocacy voice, is by following your mission.
And I also have an additional question, because we talked with Dr. Lucinda Main during the last event, and she mentioned a lot about humble leadership and how we need humble leaders moving, to meet our current realities and moving into the future. And I think that's how that's changed from kind of the traditional mindset of leaders. What kind of leaders do you think we need to meet our current and future realities?
I feel that we need people that can do things. A lot of times people are very theoretical about solutions. And there's a lot of visionaries out there. What I feel we need is people that can execute on vision, right? Like, I don't want to hear that there's this great plan coming, and then nothing happens. I want to actually see proactive steps, incremental steps to get there. And so that to me is, and you need both, but I feel like right now we have so many people talking about what they're going to do, what's going to happen, what the theory of what the best thing is. And they're always like saying these perfect things, but at the same time, there's people that are struggling today. And we need people that are ready to step up and take on the challenges today and make things happen today, and get to work, get to work, get out there, do the things you need to do, and don't wait for things to happen, because they're not going to happen unless you make them happen. That's one thing I learned very early on. If there wasn't a position that I wanted, I needed to go out there and create it. Nobody's going to do it for me. So you need to go out there, you need to execute, you need to actually be the one that gets things going, and don't wait for anybody to hand you anything, because it's not going to happen, right? You've got to do it yourself. And then associate with people that are like you, that want to make things happen too. Because if you find really good colleagues that have that same passion, that have that same mission as you do, then you will be synergistic together and make more things happen. It's much better to work with a group of people working on the same cause as one isolated individual. You can make things happen. It's just a lot more work.
Wonderful. This has been so great. Well, we only have a couple more minutes. Do you have any other closing remarks or final thoughts you'd like to add in these last few minutes?
Thank you so much for the opportunity. I always love to, speak to people, and I just hope that we get through this pandemic. And I know it's going to be people like you and me that are out there trying to make a change that ultimately, I think we are going to be the ones that make the difference. And pharmacists, like I said earlier, they're the ones right there in the front lines trying to make this happen.
Wonderful. Well, on behalf of Salus Vitae Group and myself, I'd like to thank you for joining us today and for sharing your experiences and outlooks. There were several actionable items and recommendations throughout this talk. So this is definitely one I think that I'm going to be listening to again and taking my own notes with this. So we've definitely enjoyed that. So we actually have several exceptional leaders in the coming weeks. So definitely visit our website, salusvitaegroup.com, to learn more and actually register for these upcoming events. And then, of course, please feel free to share with us. You can send us any additional questions or any takeaways that you had from the session. And we encourage you to share your thoughts and some of these takeaways as well in the different communities that you're in, and hopefully that we can kind of create these ripple effects throughout. So thank you all for attending, and we hope to see you at the next event.
Thank you.
Thank you.